Hey, it's Debbie Potts, and I am bringing back the podcast to talk about how to best fuel, train, and perform for the unique you to improve the aging process. So, if you're like me, you're at about around 50 years old and entering the second half of your life, we may need to do things a little differently. And what if you're short on time and you're trying to fit all this stuff in and you're just doing too much of everything and you are stressed out? My story, chronic stress, how it impacts the whole you from the inside out. So, how we train to increase our performance, improve our fat burning engine, to improve our speed and power and strength. So I love testing. I became an FDN practitioner so I could do functional lab testing and use that with my nutritional therapy training as a practitioner and TP, and use a nutritional therapy assessment. Combining the labs and assessment together as a nutritional therapist, pretty fascinating. So I'm more of a health investigator these days, helping athletes avoid going through what I went through starting back in 2013. So now I'm on a mission and following my purpose of working with like-minded driven individuals who tend to do too much of everything. So what is the right amount for you? It's the Goldilocks effect. Not too much, not too little, just that right dose to create a positive effect. And today we're going to talk to Daniel Crumback, who I did his metabolic expert training to learn how to better be a practitioner with my Pinoy metabolic testing equipment. And Dr. Crumback Daniel created an amazing course and ran the program for Pinoy and does some different things now, but it has a huge, extensive resume and just an expert in a lot of things, lots of trainings and more we'll go into when we get started. But I wanted to bring him on the show to talk about the heart rate training zones and what do we identify when we're doing lab testing, what is appropriate for males versus females, and if we're endurance athletes training too much volume. As I do Dr. Stacy Sims menopausal course 2.0, super fascinating because women, we can't do the same thing we used to do and expect to get the same results. So insanity is doing the same thing over and over again, expecting different results. So if we are doing long distance cardio, Stacy Sims in the course just said, well, cortisol is released from exercise, all exercise for men and women over 45 minutes. I've been told for years, your cortisol will go up. If we're already stressed pre-post menopause age, we need to use that increase in stress from exercise. Is best to not do extensive cardio in zone 2 because that could actually store fat rather than burn fat. Instead, we should use that time exercising. Our training session should include 2 to 4 max days with HIIT training intervals or short intensity intervals, 20-30 second sprints. And I talk about that with my clients doing zone 2 and then finishing with, so you kind of do a warm up and warm down. And then the midsection, the meat and potatoes, is now going to be more high intensity interval training, speed work. So we'll talk to Daniel about that, how to test our fat burn oxidation rates, strength training intervals versus endurance training. How do we know where we should spend more time with? So a lot of that we identify in Pinoy metabolic testing that I am doing here in North San Diego, the resting metabolism test and the exercise test. And then we can really personalize workout program, because right now we're just guessing. You don't really know. You don't know what you don't know. So how can you create a personalized training program, ideally with a coach that can guide you and keep course correcting and keeping you accountable? Is really important to invest in a coach. It's like $200-300 a month to invest in making sure you're having someone check on you every week. Are you doing the right things that you need to do? So, I use Training Peaks and then check on my clients' biometrics and data to make sure we're on the road to where we're trying to get to. So Daniel will help us out a little bit. So let's bring him on the show today. Thanks for listening, and send in your questions afterwards. Maybe we can have him back on. All right, guys, I'm excited to have one of my mentors on metabolic expert in metabolic analysis training, Daniel Crumback, who, Daniel, you have like 20 different abbreviations after your name, but you're very well versed in this world of exercise physiology, and you're a certified exercise physiologist, high performance specialist, certified strength and conditioning specialist, physiotherapist, sport physiotherapist, and more. So thanks for making time to come on our show and help us, our endurance athlete world, understand how to be their best self as we age.
Absolutely my pleasure. Thanks for inviting me, Debbie.
And where are you located? You're up in the
Right now,
UK.
it's hard to keep track of me. I was 2 years in China working with as the head of performance rehab, working with Chinese Olympic athletes, and then I went to the Olympics with China, and then I went to Greece to work 2 years for a metabolic analysis company as their head of science and education. In the last 2 years, I have been in England, the south of England, running a consultation business plus a lecturer at the University of Chichester in exercise physiology and physiotherapy.
Yeah.
And I'm about to take off and move to northern England in Cumbria, which is as far as you can go before you hit Scotland. And I'm going to be living in the Pennines and running a practice up there, as well as continuing with international consultancy.
So is your focus athletes up there? Is that kind of the
what's really interesting? It's always has been, like, for the first 20 years, it was athletes, and primarily endurance athletes, although I also work freestyle skiing and downhill mountain biking as well. But over the last couple of years, working with different companies, I've also really developed on the medical side as well. So, and I find this is very helpful to people who work with athletes, is to know what abnormal physiology is.
Yes.
And that gives them a better ability to analyze the data when they know what the full spectrum is. So I also now work with people with metabolic syndrome, diabetes, obesity, cardiovascular, and respiratory conditions as well.
Yeah. So that's why I want to bring you on the show, because I love testing and not guessing, and really personalizing coaching programs for clients, not just endurance athletes, but just help people improve the aging process. And especially as I'm 50 now, it's just like how to improve the second half of your life. I think is so essential for athletes and non-athletes, but everyone's always struggling to figure out, okay, how to burn fat, what should I eat, how should I train, and how should I move each day, and what type of training, strength training or HIIT training should I do? And there's so much confusion out there, but that's why I love metabolic testing. I own a metabolic testing kit, trying to get that started here in North San Diego. And I told you previously, I used to do new leaf testing back in 2005. So I've been in the area for a long time. And I always find it so fascinating how stress and all the other things can impact the results, and how we can test, figure out where that person is right now, and create a program for them. So you're just not just guessing. So why do you like metabolic testing? Why do you think it's important?
For me, it was a journey as well. Many years ago, I started off with Jörg Feldman in northern British Columbia, because as a physio, I was working in Penticton, British Columbia. It was home environment. And I was working with a lot of athletes, and I felt I didn't have as much knowledge that I needed to be working with this special group. So I took myself up to Quesnel, which is in the middle of nowhere, where this amazing man from Switzerland, I just continued to work with him for years, including doing on-site testing for cross-country skiers. So in other words, just standing in the snow, having skiers going around a 1 kilometer route while we were taking lactate measurements at that point, and heart rate.
Wow.
So I started, 30 years ago in lactate measurement, called lactate balance point was what was being used at this time. And then after about 6 years, we realized that it wasn't working. We weren't getting the metrics that we needed to be really accurate. And then we moved into metabolic analysis, and then further from that into near infrared spectroscopy. I added spirometry as being a really important component because I kept finding respiratory limitations to performance. And I knew that in order to be able to determine how I was going to train them, I needed to differentiate the type of respiratory condition or limitation they had. And since then, I also add in things like body composition as well. So those are the main four that I use now. But it's 25, 30 years of testing and analysis to be able to determine what the best combination is. And I'm the same as you. I hate guessing. I've divided my groupings, and it's funny that you mentioned, the clientele I'm working with. Just thinking about redesigning my website is the fact that you have your medical group who's interested in becoming healthy. You've got your middle group, which are the general population and the weekend warriors who want to improve function, and longevity is the big thing, right? Longevity seems to be the key word right now. And then your athletes want to improve performance, but you have to be able to communicate with them and know physiology from the three different groups. And I think the one thing about that combination of testing is you can know in each of the groups if you know how to analyze the data well.
Yeah, that's what I find is hard to say as a business owner. I just focus on just endurance athletes, but because you want to help everyone that is struggling, you're supposed to narrow it down, but I never find that possible. It's like, yes, my avatar client is me, that is a high performer endurance athlete tends to do too much of everything, and how to find the right amount to create the minimal effective dose in training. And then fueling, because that's what we've been talking a lot about on the show, is people doing the right nutrition and how to match their nutrition with their fueling. But ideally, everyone should ideally be focusing on their future self and what they're going to be doing and feeling and operating and moving when they're 80, 90 years old. So I hope all of our athletes are, training for their future self. But also, lastly, I'll say that I see a lot of athletes out there just with a bunch of triathletes the other weekend, and there's a lot of overweight athletes. And so there's a lot of people. I think this is what brought me into more of my holistic approach, is that you see people at triathlons, runners, they're working out, but they're not losing weight, and trying to understand people. Are you struggling trying to lose fat weight when you think you're doing all the right things and you're doing the training, but are you doing the rest of the stuff? And that's why I created the holistic method, because there's a lot of overweight athletes. And so, how can we help them if that's a goal, if they want to lose weight? But so why should we do testing, metabolic testing? If you are looking at fat loss, performance, or longevity, why should we get a test done? Why should we invest in that time and money?
Well, as you are aware, you have three different systems that we can measure through metabolic analysis, and then you have the endocrine system or the hormonal system, which is separate, which is super complex, and I would love to add it to the repertoire, but generally you get that through questions and through talking with physicians as well. But any one of those systems can limit health, longevity, function, or performance. The reason why I like metabolic analysis so much is that it will give me a clear idea of what system is causing the limitation, or systems, depending on the person. And that allows me to direct the training program to be able to address the largest limiting factor. And I think you end up getting much better results. And not only do you get better results, but there's an efficiency component too. If you're an elite athlete and you're sponsored, and you can afford to make mistakes in your training as long as you don't injure yourself, and you don't overtrain. Whereas the average person has a very limited period of time to be able to dedicate to training and to their nutrition. So therefore, for you to be accurate will improve their efficiency, and when you do that, then they're sold on the concepts. And I think it's how we explain how these systems, even if your respiratory system is your limitation, it can still severely limit your metabolic and your cardiovascular system. But if you address those two other systems, it's not going to fix your respiratory problem.
Mm.
So that ability to be able to really focus in on the limiting system and be able to give the appropriate training. And then if you have a good coach, as you know, you have to match your findings with their goal. And that's the fun part, is there's a training program specifically for every triathlon that's out there, depending on altitude and temperature and gain, elevation gain, etc. But that's for that race. It doesn't necessarily meet, it doesn't even need to match the individual. That's the best way of training for that race. But you have the ability through metabolic analysis to actually tweak the program to improve the limitations. And probably one of the biggest things with metabolic analysis is the setting of intensity zones. It is the most accurate way of setting intensity zones. And if you can accurately set intensity zones, then you know the physiological gains that you're going to make. Whereas, as you know, all the other systems that are out there aren't science, they're math. So that's the other thing.
You say that multiple times in your videos in the course I took. It's science, not math.
Yeah. Yeah, anything times a percentage is math.
Yeah.
So it doesn't matter if it's FTP, it doesn't matter if it's lactate threshold, it doesn't matter if it's anaerobic threshold, however you're calculating it, it's a calculation. And usually it's based upon one metric at one point. And as you know, I'm very big on the fact that there needs to be multiple metrics and correlating over a trend for it to be accurate, not by snapping and saying, oh, anaerobic threshold is 174 beats, so therefore, and you're going, no, that's not how our systems work. So I think that's probably the key thing, is I would have a hell of a time designing an intensity-based program without the use of metabolic analysis.
Yeah, because then you're just guessing where they should be. It's not as accurate. And you don't know baseline. So when you ideally test them again 3 months later or so, that you see changes, and how do you know if you've improved or not, really, without seeing baseline data that you're collecting?
Yeah, and having multiple metrics, you have the
Yes.
ability to check multiple metrics to see that they've improved. Was that the thing that improved them? And as you know, the number one thing for setting a good program is intensity. And yet it's the least understood. You know, you have tons of people who will send out triathletes and say, well, I want you to improve your speed, so therefore I want you to do 10 by 400s and I want you to walk 100. And you're going, where are you getting these numbers from? This is a mythical program, not based upon the individual's capability. And I think that's where we need to be. The word I use is called respectful training. It needs to respect the individual, and it should be more individualized. And the way to individualize it is by thorough testing and retesting and adjustment of the programming.
Yeah, for sure. I love that, because that's even what I do as a more of a health investigator when I'm doing functional lab testing, is that you're collecting clues. And that's why I really wanted to do the metabolic testing again, because it goes right hand in hand with my blood chemistry panel, and look at hormones and look at GI tests. And then you can really create the ideal personalized program for somebody, collecting more data, putting the missing pieces of the puzzle together to then figure out a program for that individual with their exercise, nutrition, and health.
Yeah, well, for example, like with some of the international consulting I do around the world, they send me data and I do the analysis, and I do interviews with the client, and they find that better, even though that they're testing, let's say in Georgia, they find it better for their clients if they send me the data and then I do the review, then they follow my recommendations for the next 8 to 12 weeks and retest. And we had a very interesting case that was, if you did not know the medical side, even though this person was a higher level athlete, I picked up the fact that the max heart rate was flattening out in the last 2 minutes, and there was no cardiovascular history, no beta blockers, nothing like that. Went through the respiratory system, was performing well. Went through the metabolic system, was performing well. And and I went back to medications to find out the person was on antidepressants and had ADHD, and those medications can stunt max heart rates.
Mm-hmm.
So it was being able to pick up that stuff and say, well, it's that medication that's limiting you. I'm not suggesting that you get off the medication. I said, talk to your doctor about the ramifications and whether you know, if you want to be able to perform harder, you're going to have to either change medication that has less profound effects. And they would discuss it with their physician. But that's the type of thing the average person doesn't know. And you can pick up all these subtleties. You can pick up overtraining beautifully as well. A really stunted heart rate recovery in the first 1 minute or VCO2 recovery in the first 2 minutes. It's a very key sign. Obviously, your resting heart rate going up and having other metrics going up at the same time are good. But with metabolic analysis, you can pick up really key things to be able to pick these other things up.
So let's kind of walk through the test. If you're doing a metabolic test and you have a great way to personalize, figure out what the protocol should be, let's kind of just walk through that. And then I wanted to get into the zones that we identify, because that's a whole other conversation. But so many people don't train right, and they don't do the short intensity interval sprints right with the recovery, and then the high intensity interval speed work that we keep all hearing about, and then the zone 2. So let's kind of walk through for everyone, what is a basic test? How do we create that personalized protocol? If we can just summarize that.
Yeah, after about 5 years of testing, I got frustrated because even talking with my mentors, it was sort of like, well, if it's a woman and she's a fairly good cyclist, she'll be starting at about 100 watts, and you can go up by about 20 watts. And for my protocols to be strict, and for me not to miss the bottom end or the top end, and not for the test not to be excessively long, depending on which test I'm doing, right? Whether I'm doing a ramp or whether I'm doing a step, for which I would be after different pieces of information for either of those. What I did was I created what I call a parameter check, and a lot of people are using it now, which is it's based upon, I know that I want to capture data that's around 100 beats. That will make sure I start low enough. So what I do is I'll set whatever wattage or whatever speed to be able to achieve about 100 beats. And that way I'm not going to miss the bottom end. So when they switch from mainly fat to carbohydrate, you don't want to miss that point. If you do, you're not going to be accurate with recovery or even potentially zone 2. And then making sure that it's of an appropriate length to achieve your goals. And what I do is I get them to tell me what would be a 9 out of 10. And I'm looking for that top wattage or speed that they're going to be able to push if they pushed it for 2 minutes. And then it's a simple case of 1 minus the other divided by the number of steps you want. So if you want 9 to 12 minutes, then you just divide it by 9, and it will give you the increments. And it doesn't take long. A parameter check with me takes about 5 minutes. I don't believe in standardized protocols. For the company I was working with before, that was all standardized, and I don't agree with it. It doesn't take long to be able to get the information, and the data is too important. And this will give you a really good split of your data over the time, and you'll be able to see clearly the changes in fuel systems that they're using as they go along.
Yeah.
So I think parameter check is extremely important. Whether it's people say, well, this person doesn't want to run, and as you know, I created walking protocols, and with combinations of walking and inclination for hikers. It doesn't, if you use that same system, it doesn't matter what you test them on. It works every time. And I also do endurance-based ones with my endurance athletes, which are 52 minutes in length.
And the point of that is to see what their heart rate and fuel source is at different intensities.
that's much more about fuel sources, and I really look at the near infrared spectroscopy results using Moxie or Nox. You can be able to see how well they're delivering versus utilization. That's the big thing, right? Which systems are the limitation, because it's always one or the other in there. It's either a delivery problem or a utilization problem of three systems. And with the data from that, it gives me a clearer idea of if I want to do race planning on their nutrition. It gives me a lot better idea because it gives me 10 minutes at each intensity. And your body reaches homeostasis within 5 to 7 minutes. So it really does give you a clear idea of whether they could continue this for 30 minutes or 2 hours and stay in the same fuel source. So I find that a lot better for race and training planning.
Yeah. So when you're doing the testing, what we want to look at are the different fuel sources at different intensities. And then we create the zone training that we were talking about, that there's the 5 zones that they use typically. And what are you looking at when you're testing for an athlete? I mean, we can break it down if they want to improve fat loss, which is, 2 different zones probably, and performance gains and longevity. But we look at training when we're doing the testing, what fuel sources correlate with the zones, if we can kind of touch on that a little bit.
Yeah. So at the lower intensities, what you're looking for is the body will normally be able to work at a lower heart rate with about 90% fat, maybe even 100%. So on a metabolic analysis result, carbohydrate will be flat on the bottom, and fat will be running relatively flat. But at a half decent amount of kilocalories per minute. That's the other thing that you get from metabolic analysis, is the fact that you can see that the person's, burning, 9.2 kilocalories per minute of fat versus somebody who's burning 2.8. And you're going, well, yes, you're using a high percentage of fat, but the actual amount of fat you're using is quite poor. So that can help us decide how to set programs to get them to be able to burn fat more efficiently itself. There's a point at which carbohydrate starts to rise, and they'll be both contributing, but fat will be contributing significantly more. And then that runs to a point in which the carbohydrate will cross the fat and will start to be a larger contributor than the fat. And that's it's referred to as crossover. If you're, as you know, when you look at your data, that could happen during a single increment during the test. So I don't use crossover as the top of my zone 2. I'll find the point where they lose homeostasis, where the fat's flat and the carbohydrate's flat. If you get this within a minute, what'll happen is, that if they continued at that heart rate or that intensity, they would have crossed. So you're fooling yourself if you think that's zone 2, because that actually, they might be able to run there for 1.5 to 2 minutes. And they're going to be in carbohydrate, which means they're in zone 3. The real definition, right, of zone 2 is that you'll burn a majority of fat for a significant period of time without having a higher concentration of carbohydrate being used. So I'll always look down and move it to the left from the crossover significantly to be able to pick up the point. And then what you're looking for, I mainly use breathing frequency, because chemoreceptors and mechanoreceptors in the body are picking up elevated levels of CO2. And elevated levels of CO2 are representative of higher levels of hydrogen ions at the muscle itself. So when CO2 levels go up, there's a drive within the respiratory system to breathe more frequently. And therefore you'll see a pickup of the frequency that naturally happens at several different points. When they switch from zone 3 to 4, the elevation will be significant and be kind of between 30 and 40 breaths a minute. And then in zone 5, the breathing will go, from 40 to about 50, 55 breaths a minute. So I look for those changes in the breathing in response. Hard part is with all the people reading online about breathing, they're actually interfering with their chemoreceptors, mechanoreceptors from making really good decisions. And they think they're doing something to help themselves, and they're not. They're actually interfering with the biochemistry in their body. And and then people buy into this whole idea of, well, I'm going to improve my ability to for carbon dioxide tolerance, and you're going, there's no such thing as carbon dioxide tolerance. Cells are not going to develop a tolerance for it. What you're doing is you're making it much harder for you to be able to do the same thing. So the only time I can't use breathing frequencies at the higher intensities is when I pick up, and it's really easy to pick up somebody who's using their cerebral cortex to be able to control their breathing instead of their old systems, which were much more effective at being able to respond to changes in biochemistry. So that's how I zone. There's no percentage anywhere, and it works really well. Despite the fact that we have, we can measure thresholds. I don't use them because if you have a threshold, it might be because you have a respiratory limitation.
I mean, anaerobic threshold or what threshold?
So anaerobic threshold is based upon respiratory data. What if the person has a respiratory limitation? Then that's not their anaerobic threshold. It's a problem in the limitation of the respiratory system. And again, it's one number where they'll say there's a rapid increase. And I don't look at single numbers. I look for trends that you'll be able to pick up and are quite obvious to people when they've been taught how to be able to find those trends.
So is it the breathing, you're speaking back to the breath work people are doing? Is that, any examples of that? I know you talk in the course about the nasal breathing too much and just how we should breathe through our mouth and not try to work out hard and nasal breathing. And any examples on the breath work that you're saying isn't beneficial?
Yeah, people believe that breathing slowly no matter what is good. And they don't, this is all taken from yoga or deep diving and stuff like that. But that's not what you're doing when you are running or when you're cycling at a high intensity. You're changing your biochemistry on purpose, be it by changing fuel sources that you're using to be able to create ATP at the rate at which you need it to be able to do that task. And natural byproduct of that is elevated levels of hydrogen ions. And you'll become acidotic at the cell, and therefore you will not be able to function. Your body's system to be able to deal with this is the respiratory system as a major player. And if you're not allowing your breathing to speed up, to be able to blow off the carbon dioxide and get rid of the hydrogen ions, then you're going to promote the acidosis. And there's all kinds of ramifications. And some of the discussions about nasal breathing, first of all, it makes no sense to use two small holes versus the big hole in your face to get the volume of oxygen there and to be able to control your breathing. And if you want to breathe slower, you can breathe slower through your mouth. You don't have to breathe through your nose to breathe slower.
When you're exercising.
Right. When you're exercising, it's good for, if you want to calm down, it will slow down your breathing because you're not going to be able to get as much air in the same time. So you're going to breathe slower to keep the same volumes. Whereas during exercise, and the other thing is this, they'll falsely promote things like nitrous oxide will help your airways, and the nitrous oxide is in the nose, has nothing to do with the cellular nitrous oxide. They're totally different constituents. So there's a complete falsehood with that as well. But it's become extremely popular. I have to spend a lot of time undoing it. Not that I don't think there are respiratory limitations that can be improved significantly through respiratory training. I just don't think it's by breathing through your nose.
Yeah. So that's a good kind of topic to go into. What are the common limitations we see? You're talking the term respiratory limitations. Let's kind of go into the common ones you see when you're testing. Why is it so important to do the testing to identify these limiters? Or which to me is the areas of opportunity where you need to focus on your training until you test again to see where if you are striving to improve. So what are the your common limiters?
I've kind of come up with my own system, which a lot of people are using, which works quite well, which is you either have a respiratory capacity limitation or a respiratory capability limitation.
Mhm.
I like defining the differences. You know, the capacity, if we look at it from a respiratory point of view, is what is the amount of air that you can move in your lungs, and how quickly can you get that air to leave and fill the lungs. So I look at things like what's called spirometry, which is measuring forced vital capacity, which is a 6-second test. You exhale after taking a deep breath in, which allows us to be able to measure the functional area of your lung. And then we also look at FEV1, which is the first 1 second. How much volume can you get out in a hurry? And we use those for capacity, because obviously if you're going to be breathing 55 breaths a minute, the 1 second value is going to be really important. You're not going to keep a really slow, deep breath in and breathe out like you will with a 6-second test. But during that 1 second test, we want to know how quickly you can get stuff in and out. There are sets of norms, of very large pools of norms. So we use what's referred to as the GLI, Global Lung Index. And what it does is allows us to be able to put the person's age, gender, height, and ethnicity in, and be able to look at their spirometry results that we get from a simple test and be able to determine whether they are within the normal for that particular grouping. Then we use the metabolic analysis data of how they breathe during movement. And that's the capability. How well can you use the volume you have? So the capacity that you have during the test. And you can find capacity limitations in which their capability of using it is as good as it's going to get. Then you have capacity limitations, and they can't even use that very well. So they have poor capability. And then you have normal capacity, but they're unable to use it during movement. So and the reason why it's important is the training needs to be different depending on what you're finding. You can't improve capability if you can't improve capacity, if that's the limitation. So my firm belief is that you want to work on capacity if that's where the limitation is. And this is where a lot of the devices that are out now are all resistive based. It's all
breath
about
work.
It's making it harder for you to breathe. And if you have a capacity limitation, making it more restrictive is going to make you better at breathing that crappy amount. You know, that's not the right idea. It would be like saying I'm missing the last 15 degrees of elbow extension, so therefore I'm going to put on 50 pounds of weights and do bicep curls. And you're going, well, that's not going to work. We need to get your elbow to straighten all the way first. And in that new range that we gained, you're not going to have any strength or capability in that range. So we're going to have to build capability on the capacity. So it's a very structured way of doing it, but it works beautifully. And it works on anybody who has a diagnosis of COPD or asthma, all the way through to the elite athlete, where you can increase their volumes per minute, what's referred to as VE, by 80 liters a minute, by adjusting. If they have a capacity limitation and you train capacity and then capability, I've moved people 80 liters a minute, and it's moved them way up in their professional goals. And it's moved a lot of people that were medically restricted way up in their function and their longevity as well. So I would consider those as the two majors. And what's fun is there's a flex in between them. Once you gain one, you're going to have to go get the other one, which is it's very physio in a way.
Hmm.
It's if I'm going to get you another 15 degrees of range, I've created a monster of which I'm going to have to train you in that new range to get you better. And a lot of it has to do with diaphragmatic mobility,
Yeah.
right? The thorax and the ribs need to be able to move. So I think this is why I like my cross background. Like my strength and conditioning is very strength conditioning. My mobility is very physio based, and then you've got your physiology side of the house. So if I want them to be able to increase their capacity, I will look at diaphragmatic mobility. I'll look at thoracic and rib mobility. I'll do manual therapy and manipulation to be able to get them moving better through those areas. But if I put a device in which I'm turning up the resistance, I'm going to stiffen that diaphragm. And therefore it's not going to result in more volume.
Yeah.
So yeah.
I think it's so interesting because I always say the definition of insanity is doing the same thing over and over again, expecting different results. And I think it's so important as we get older as athletes and we want to improve performance. And, I always say fight the saying that you get slower and fatter and you can't do stuff because you're getting older. I would say no, it's just that you have to adjust how you train, fuel train, and perform as an aging athlete, and not just say, oh, I'm getting older, so we just need to do different things, not do the same thing over and over again, expecting the same results doing the program you've been doing for 20 years. That's just not working
Right.
anymore. So it's
Yep.
good to
And
identify.
you've got to be realistic with your coaches. If they don't have this data or the capability to do it, and they're not accessing professionals that do, then you are going to get a kind of a very traditional program, which is very appropriate for the event that you're doing, dependent upon your capability, right? So people always get mad at doctors all the time, and I'm going, why are you mad at your doctor? Oh, they didn't do this, they didn't do that. I said, they have 4 things they can do. Did they do at least one of those 4 things? Did they test it? Did they refer it? Did they inject it? Or did they medicate it? Because that's the 4 things they can do. If you're going to see a doctor to see something else, I don't know why you're seeing a doctor. And the same thing with coaches. I work with a lot of coaches because that coaching, I consider, I've had tons of debates of who's a coach. Am I a performance coach, or is it the coach is the one that rides with them, that goes to the track and runs with them? That to me is traditionally a coach. I'm your science guy, right? I'm the one who will test you, and I'll explain to you and your coach your physiological performance and make recommendations on how to tweak the program specific to your race to be specific to you.
Yeah.
I would like
You
to see
need
more
that.
coaches just, work, if you want to work with me, go get tested and from the basis of this analysis, we'll design your program. And I want you to go back, every 12 to 16 weeks and be retested because I need more accurate data.
Yeah.
And it's a perfect life to be able to do it that way.
Well, and I was trying to figure out the name, but integrated health coaching, that I'm trying to connect with naturopaths and physical therapists and chiropractors. You can't help your patient get well just with what you're doing. You need a referral network and how we can integrate all of the services together. If our mutual goal is to help the client patient be the best version that they can be and help them reach their goals, well, we need to partner up and integrate all these different services together, because you can't just do it all yourself and keep up with it to be
So,
effective. So that's
huh.
so essential.
I think everybody will benefit from a team. That's for sure. And I'm with you. I worked with a lot of naturopath, and nutritionists and dietitians, but very specifically on the sport side. Because if you don't, you know enough that you get frustrated dealing with people that won't be adaptive in their thought process and innovative. And I think that's people always ask me, well, how do you feel about extreme diets and stuff like that? And I said, I don't have any problem when they have metabolic syndrome. I think, but that's because they have an abnormal physiology. Essentially, we need to go to the basement and find the fuse box and turn everything off and turn it back on again. and try and reboot the entire system. And for that, you need to do something extreme. For most, you don't have to do anything too extreme to be able to adjust it. And a classic case is those that have long-term obesity and metabolic syndrome. They still have it after they've had surgery. That's the weirdest thing. You can test them, and yes, they're losing weight at a massive rate because they've limited the size of the stomach, right?
Yeah.
You put them on a metabolic analysis test, and they're still looking like a metabolic syndrome diabetic. And you're going, yeah, that makes sense. All you did was change the stomach. So it was. I've worked with a very influential physician surgeon from New York, and that's our discussion all the time, is the fact that metabolic analysis will help determine who will need that surgery, who would best benefit from surgery. Because when you have somebody who's moving at 60, 80 beats and they're 90% carbohydrate burning, there's a problem that's going to take a severe approach to be able to change that. So I think that's the fun part of working again with medical all the way through to elites. Is I never thought I'd be interested in medical, to tell you the truth, but it's a heck of a lot of fun working on it, and you get better with your athletes because of that.
Yeah, I think just getting that data to see, oh, this is what's going on inside. You don't know what you don't know. And if we can get some type of test to look under the hood to see what your metabolism is doing at rest and during activity and exercise, for more people trying to go higher heart rates, is essential to know where to direct them to next. So when we do the exercise test, and I want to touch on the resting metabolism test, when going back to the zones, because I think, what fuel source in zone 1 to zone 2, what fuel source are we using?
Well, you're mainly looking for free fatty acids in zone 1, right? And yes, sometimes there's a goal for fat loss, though, but a lot of people, it also is a very good indicator of a recovery intensity. So that's what I like about it, is that zone 1 is all about recovery. And when you're doing intervals at high intensity, it gives you an idea of what they need to get down to be able to recover appropriately. So you got a team from like a newbie to a higher level, and you're meeting them at the track, and everybody's doing 400s with 100 recovery. You're going, well, if you got 10 of them, 2 or 3 are probably going to be okay. But there's going to be people where the recovery is too long, and for some that they never recovered at all. Yeah. So what's nice about when you're looking for that free fatty acid level, right? Will give you a clear idea of when they're really recovering well. And then zone 2 is you're in that system where you're using everything you're producing, you're using well through the aerobic systems itself. So that's zone 2. Zone 3, you're getting a little bit of lactate shuttle going on, but you're handling it well through the system. The aerobic systems are still processing at a rate in which it's not massively increasing your lactate levels. Not that there's anything wrong with lactate. Lactate is next to glucose is one of the best fuels for performance, and people are still confusing lactate as being a limiting factor to performance, and it's not. It's interesting that it accumulates at a massive rate when you change to the last 2 fuel systems, which are going into ATP, CP, so the creatine phosphate levels at the highest intensity. And people, unfortunately, so many people have seen have seen the classic graph of, well, the first 3 minutes is this, and the next, or the first 10 to 30 seconds is CP, and you're going, that's not how anything works. I'd like to get rid of that graph for everybody. Is being able to say, if you can do 10 to 30 seconds that at that intensity, it will represent that's the ATP being delivered at the most efficient way possible. So you've got, it's a great discussion about efficiency. you need a production rate. I prefer to use that. You need a massive production rate to be able to do that effort for the last 10 to 30 seconds, and that would be your zone 5. That's why intervals, if you're doing an interval that you can do longer than 10 to 30 seconds, you're probably not in zone 5.
No.
And a lot of people will say, well, why do a maximal test? You can do a sub-max test and calculate. And you go, calculate? That's math again. Ideally, you can take somebody up and be able to capture what they're capable of doing for the last 10 to 30 seconds. And that will be mainly creatine phosphate delivery as the fuel system there.
And 5. So a good topic is people trying to get faster as they get older. And Dr. Stacy Sims for female athletes talks about, less zone 2 time for females as we're post menopausal, and more time doing short intensity interval training, which would be zone 5 down to zone 1, and then some time into zone 4, which are the high intensity interval training. And so to train your body, as whole nother topic though, decreasing hormones, and I've been diving into this, how we can improve our fat loss by doing interval training, and not to overtrain, doing it too much. More is not better, but just the right amount of proper interval training. Because as you said, a lot of people don't come down to zone 1 and they don't stay in zone 5 for that 10, 20, 30 seconds. They'll hit that number, but they're not staying there 30 seconds. So any thoughts on how to properly do the short intensity interval training to improve fat loss? And for females versus men?
If we look at it as, if we define zone 5, right, that you're using 100% carbohydrate, so you're using no fat. There is some latency that's used, but that's mainly, if you watch that data, if you look at the research, it's mainly with resistance training, not with interval-based training. If you look at that and you go, okay, what are the physiological benefits of working out? Not the functional limitations. The physiological changes are to increase mitochondrial density and capillarization. So everybody talks about zone 2 is doing that. Yes, it is one of the best ways, but zone 5 does it as well.
We need combination of
2 and 5 is magic, but hey, we wouldn't know unless we tested.
Yeah.
If their zone 2 is fine, leave them alone. Once a week, they'll do it. I think that's the real difference, is they would find the results would be better if they tested and trained their limiting intensities, right? And they got the physiological changes that they needed. So if it has to do with mitochondrial density, capillarization, and the metabolic systems being able to be able to be working effectively and efficiently, I find there's zone 5 is usually not met by anyone. And you're right. With me, as you know, I'm a firm person that bring them to 5, bring them to 1, and you can keep your work to rest ratios the same, because the length of time it's going to take let's take a fit person to get zone 5, they're going to get to 5 slower, and they're going to get to 1 faster. If you take somebody who's unfit, they're going to take longer to get there, and they're going to have a hard time holding it, but they're going to take a lot longer to come back down to zone 1 to be able to recover. So they're going to get the same length of time in the zone 5, but the more deconditioned person is going to get a shorter recovery. Not because they gave them a different ratio, it's because of the length of time it took them to be able to bring their heart rates back down. Yeah. And to get in that recovery zone. So I just don't use work to rest ratios, but they're all based upon this time, the equivalent time, whether it's a 1 to 3, 1 to 4, 1 to 5, the equivalent time is the clock doesn't start ticking until you get into zone 1. Yeah.
And that goes back to the example of the track workout. You said, I experienced this. I went to San Diego Track Club workout. It's 400 meter on a track. Everyone goes together, and then they do 1 400 meter, one lap around, and then recovery, one lap, and they're all running or jogging.
Yep.
I'm walking, like I can't get down to zone 1 and go hard again for 400 meter. I don't know how you guys are actually doing speed work. And so I haven't been going there.
They know what they're doing, right?
Yeah.
I mean, you can't tell me a track athlete knows that they're going to show up at the track and they're going to be asked to do 10 of them, that they don't gauge themselves to be able to do the task. Rather than saying, no, I want you to be able to get up into zone 5, maintain it for a period of time, and then be able to recover.
Mm-hmm.
Because logically, it will take them longer to get in zone 5 the first time they do it.
Yep.
But they'll recover faster. By the time they end, they'll be getting up into zone 5 by the 10th repeat much quicker, but recovering much slower. And this is normal physiology. This is what will happen. But each one of those efforts will be maximal. Whereas if they know what the coach is up to, they're just going to go, well, I'm going to gauge this to be successful with the task. So yeah, I think it's a really easy way of doing things. I even developed an app with Roger Schmidt at Moxie on the Garmin's to be able to punch this in, and it wouldn't start the countdown clock until they got to their zone 1.
I heard you say that.
Yeah.
That'd be great. So the other thing is zone 2. I know back in the day when I started doing Ironmans in 2001, we worked with Phil Maffetone, did the 180 minus your age is your max aerobic function heart rate. And then we started doing the metabolic testing. So we were not guessing. Around 2005, I started doing New Leaf. And I worked with Mark Allen. I was on his elite triathlon team for Ironmans. And so we trained always by heart rate. Sally Edwards, actually way back before that, was 1995 when we were doing heart zone training, and she taught me, and I helped her with the heart zone seminars, and I did that. So I'm really sounding old, but that's how long I've been doing the heart rate trainings. But we used to always train. Even now, everyone talks about zone 2 or the MAF heart rate. That's where, as endurance athletes, especially Ironman marathons, 50K, 100-mile run, that you want to stay. And so training that volume, the benefits of zone 2, but then you hear now, as I'm learning from Stacy Sims, for example, that we want to do that polarized training 80-20. So 80% of the time is zone 2, 20% of the time you're doing the intervals. And then there's, Stacy Sims saying 80-20 within your workout. So you're doing kind of zone 2, but then you're finishing with sprints. So any insight on how we should be training and for endurance athletes, if they're looking at performance gains? Is it how much in zone 2 or whatever we identify in their test?
As a natural kind of continuation of what we discussed, I don't guess. One of the things that drives me the most crazy that fits into this is it's March, so therefore I have to reestablish my baseline. Why have a coach? Just buy a calendar. You'll know what month it is. It doesn't make any sense. Get tested, right? What does it normally work out to be? My guys with really good base will do base once a week, unless they need it for the race, right? Mm-hmm. And that's the thing, how much mileage they need to be able to know that they can do it mentally, physically, right? There needs to be the load there. But they're only going to be doing once a week for me physiologically. They've got it. The real trick with triathletes is your baseline for running, physiological baseline for running and cycling, are they different? And I always have this discussion with them and saying, do you think you have mitochondria specific to running? Do they turn off as soon as you get on a bike? Of course not. Quit doing double base on things. Now, mileage is different because that's specific to the race. That ability to be able to tolerate being on your bike for that period of time at that wattage, that's different. That's race training. But physiologically, a lot of the people I look at, unless they've had wrong zoning and have spent most of their time in zone 3 and have destroyed their base, because a lot of people don't realize if you do zone 3 and 4, you'll decrease mitochondrial density and capillarization. And at either end, and you're going to make yourself significantly worse.
So you get talk about that, because that's big. Because I think I always say a lot of people are training in that gray zone, that black hole training, and it's counterproductive.
It is. It's not only not helpful, but it's actually detrimental to your systems.
Because you're damaging mitochondria or creating more oxidative stress.
You're decreasing your mitochondrial density and your capillarization.
Wow.
Yeah.
Huh.
And this is why with 2 and 5, I go in working with triathletes with the hope that base is there. Because I want some time to work on strength, or I don't want to find too many physiological limitations, because then I can work on things like wattage repeats instead of heart rate repeats and stuff like that. Because I'm not, everybody thinks that everybody who's into physiology is heart rate based only, and I say no. If you have no physiological limitations, I can give you a program that will maintain your physiology, but then we'll hammer the function, right? Which, let's face it, that's wattage on a bike is extremely important. If I can get you to push more wattage,
Yeah.
then it's so much better. If that can happen in a weight room and transfer, then great. But I would say I couldn't tell you a percentage. I could tell you a percentage of athletes that I find that have, and it'll be the middle grounders that have destroyed their base, that I have to do a reestablish the base. The overtrainers as well. But a lot of the times you can work your cardiovascular guys in zone 3 really well. And also there's always a physiological improvement and a functional improvement. Like if you're doing zone 3, it allows you to be able to suffer, and it's more race specific. Most people will race in zone 3.
Yeah.
And whereas zone 4 will make you faster, or be able to maintain a higher wattage for a longer period of time. Great. Zone 5 doesn't have very much function, because you're not drafting and you're not racing at a level in which you're sprinting. So therefore it's a physiological zone that gives great benefit that people don't realize. It's as good as zone 2. And my feeling is we'll find out in the next couple of years that it's because it's mitochondrial density and capillarization in fast twitch fibers.
That's a big part of it.
Yeah, I think there's something to be said about that, is the fact that we need to load high enough for a short enough period of time. I think it's activation of those particular fibers. And therefore we'll see an increase in mitochondrial density and capillarization in them, which is beneficial overall, because they don't not work. They're always there to be able to help turn over products of non-aerobic, which I hate the word aerobic and anaerobic, but they use the byproducts to turn back into fuel. So the more capillaries you have, the more mitochondrial density you have, the better.
Yeah, that's why I find it fascinating. Use it, you don't use it, you lose it if you don't use it. It's like the zone 5, that is, so we don't often do that because it's hard. It's challenging, and people don't want to push themselves that hard. And I hear that a lot. And I know I'm trying to add that more in, and my routine is doing that zone 5, and it's hard to get there. You have to be well rested. That's why we want to prioritize our sleep and manage our stress and figure out nutrition. So you have those days that you feel good, that I'm going to add that 20, 30 seconds all out, because you can't feel like that all the time. Or I don't feel like that all the time.
And thank God there's some research out in the last 5 years about, what if I do my high intensity before I do my low intensity? And what if I do my high intensity after I do my low intensity? And there's nothing clear out there yet, but it doesn't seem to matter either end, but it would be better done after. That's what it's starting to smell like. I'm not saying, if you just go and have a look at the research, there's not much on it. But it's a really good question that needs to be sussed out a little bit more. And I think part of the problem will be, it depends is going to be the answer. It depends on the individual, right?
Yeah, it always depends.
It does. It does. And thank God it does. Because we'll be part of the joy of looking at near-infrared spectroscopy, like with the MOXIE or the NOx, is the fact you can see them desatting. So the muscle oxygen plummeting when we're in that intensity. It'll drop 30-40%. So it measures the percentage of oxygen on the hemoglobin. All of a sudden your hemoglobins are kicking around 40%, and all of a sudden it'll drop down to 8. And it's just You know that your cellular structure is just ripping the oxygen off the hemoglobin at the cell. And you go, that happens at the highest intensities.
Yeah.
So you add that nice little component into the training, because let's face it, metabolic analysis is not really conducive to training. It's really not easy to be able to do the training with the mask and all that kind of stuff.
Mm-hmm.
Whereas you're having devices like Moxie and Nox now, and I think Nox is the newest on the market, NNOXX.
Mm.
A good friend of mine, Evan Pycon, has really put out a good product that can be worn during training.
Mm.
And you can actually see these changes of oxygen delivery and
Wow.
utilization on a small device about that big.
Really?
Yeah, and it'll
Oh.
measure directly at the tissue, muscle oxygen delivery and utilization. And for me, I find that to be quite exciting to have something that's reasonable. It's like technology, everybody's bashing it on Twitter, and people are really grumpy lately. It's like horribly taking pot shots at each other, and you're going, I don't understand this. And then you got
Yeah.
the lactate boys are all back, and you're going, oh, I did this for 8 years. And you get all that, well, you should, if you're swimming with a watch on, you're an idiot, and you're going, I wish people would just keep these weird
Yeah, they have too
statements.
much time on their hands.
It's quite awful, and people bashing everything else, and you're going, listen, if you want more data and you're going to use it to be able to adjust your training to be more successful, then by all means, what's the problem to everybody else?
Mm-hmm.
So yeah, I watch it from the side, and then most of the time I just keep my mouth shut because it just irritates me. But I have to walk away. One day I'll actually be go in there, but I don't want to waste so much of my time just
I know,
responding.
so I just ignore it.
Yeah.
So we're going to run out of time. There's so much to talk about, but I do want to tie into the testing. How do we figure out how much time they should spend in the strength training versus interval training versus endurance training? How do we identify that?
From the RMR, it's a good kick in from the RMR.
Yeah.
So the resting metabolic rate test it gives you it's the gold standard in determining your metabolic rate, which of course is extremely important for anybody who wants to work with nutrition, whether maintain, gain, or lose weight. It's the gold standard. But in addition to that, we can look at what percentage of fat versus carbohydrate they burn at rest. And what we're looking for is at least 70% fat to 30% carbohydrate. By looking at that, we can determine all kinds of issues related to, it could be nutrition, or it could be usually training, right? It can be a medication in some cases, but if we look at it as being mainly nutrition based or their physiology, right?
Mm-hmm.
If you look at that and you look at the metabolic rate in relation to others, their height, age, gender, you have norms. If they tend to be slow, so their metabolic rate is slow to others, you can extrapolate that they have low lean muscle mass. Now, that's why I use body composition in combination with it. So resistance training goes way up when metabolic rate goes down, because I need to increase the lean muscle mass to increase their metabolic rate back to normal. And that the best way of doing that is adjustments to nutrition and resistance training. This is where, with diabetics, it got to be this big thing of just get them to the gym and get them lifting weights. And you're going, no, there's some diabetics that have normal metabolic rates or fast metabolic rates. They're not going to respond by increasing the lean muscle mass because they already have good lean muscle mass.
Mm.
So
That's
you
not
end
the
up
issue.
destroying the effectiveness of a particular tool we have just by inappropriately putting the wrong people attached to it.
Mm.
So to answer your question, I would go off body composition, and also performance and metabolic tests if their wattages are exceedingly low, right? And particularly for cycling.
Yeah.
And we just look at it and go, oh, we got to make you stronger. You can't top out at 220 watts. You're not going to be successful. So those are the three things I look at to bring up the prioritization of resistance training.
Mm-hmm. Yeah.
Unfortunately, everybody calls it strength training, and me, I just like, it's resistance training, and there's 4 different things you can do with it. A lot of cases you're going to be looking at hypertrophy for those who have low lean muscle mass, and you're looking at strength for those that have good lean muscle mass but poor output. So, and it's a total difference in the rep sets and loads that you use. This is my strength conditioning side coming out. And thank God, pay attention to the research. There's tons of really good research coming out on different loading for hypertrophy, strength, max strength, and power. The bad news is hypertrophy is coming in, and everybody agrees it's a massive range. Will be successful, and this goes back to what you said. Do something different. Don't go to you've got to change up your resistance. And one of the best things you can do is just change what you're doing in the gym. Change your loads. You don't have to change necessarily the exercise, but change your loads. And remember that everything that you do in triathlon is reciprocal. So for God's sakes, don't just squat and dead. It's you have reciprocal gait in both of them. Don't be afraid to move to some unilateral stuff.
Yeah, for sure. Need that. And then lastly, the macros. Are you able to identify areas of their carb, protein, fat based on their RMR, and even tying that in with their exercise test? I know this on the sheets that we look at the data, you can somehow tell information.
Yeah, that one's a little bit more, it's a little more out there. It's a lot of math in behind
that's
the
what I was thinking.
calculations.
It doesn't seem accurate to me. So I just was wondering, how do you figure out macros?
I would look a lot at the results during the metabolic test, the active test, and look at their needs. But you know me, I'm a firm believer in you got to give me 2 to 4 weeks of data on how you're eating now. I need to know where you are now. Otherwise, I don't stand a chance. So I usually just say, I don't care what device you use, and for God's sakes, be honest. I'm not going to
most people are not.
Oh, they're horrible. And then what they're doing, they're fooling themselves, right?
Yeah, I know. So it's not fooling me. It's you're lying to yourself. So it doesn't matter.
Yeah, absolutely. So yeah, I think I set my macros based upon that. And it's very challenging. It's, you've got vegans, vegetarians, you've got people that are doing keto and asking a ton of stuff like that. You got the fasters. Everybody has an opinion on nutrition right now.
Yeah.
So it gets to be very challenging, that's for sure.
I know. We've been trying to dive into that on this podcast. I'm trying to bring on more people that are carnivore, because everyone has questions, because now it's gone from, paleo to keto, low carb, to now strict carnivore. And then all the fasting stuff I've been trying to dive into, because all this information out there isn't designed necessarily for the athlete there. So everyone, all these athletes I think are trying to do this fueling program and fasting based on metabolically unhealthy people that are trying to heal some health issues.
If I could say one thing, if you think you're going to burn a higher percentage of fat by not eating, by not eating before you train, it's wrong. It's what you burn is based upon the intensity at which you're working out. It has nothing to do with, it's not going to go, there's not as much, I'm in zone 3 and I'm going to be mainly burning carb, but there's not enough carb here, so I'm going to burn fat. Your systems don't work that way. In fact, if you put it out there with low levels, it will eat protein long before that, and you're going to undo a bunch of other things. So don't think that fasting leads to you using more fat. It just is not true. And in fact, if you're fasting, you might actually have to force yourself to drop down to zone 2. Then you're going to be burning more fat because you don't have the energy on board to be able to produce at zone 3. So please don't do it with the idea that you're actually going to change the fuel that you're burning. It's all based upon your intensity.
And that's a big topic. I mean, that's an hour-long conversation itself, because it has been in the last few years of fasted exercise. Do you eat or not? And I know there is research coming out, and I've seen posted that is eating before or after, it doesn't impact or fasting doesn't change was it? Your performance levels are not altered if you eat or don't eat or something like that. It was like you weren't, I don't know what it, someone just said, something about your fueling being fasted isn't going to make a difference. No, it would make a difference, you're saying. But
Most people
performance,
haven't.
but maybe fat loss, burning fat or not. Maybe that's what it was.
Right.
I don't know.
Yeah, it doesn't make any difference to burning fat. Intensity does. In most cases, we have more than enough on board to be able to train. So for those people that like to get up in the morning, and I'm one of those, I don't eat and I go train. I didn't fast. You're telling me I fasted now, and I didn't fast. I just been training that way all my life. I just don't like eating before I go out, but I know I have more than enough on board. And it doesn't mean that I burn more fat. It just depends on the intensity I go out at it.
Mm-hmm.
So
Yeah.
I think that's a big thing, and their measurement, what they're measuring as a feedback of it, it will confuse people.
Mm.
You know, that's if you really know the question you want to know, because that's the number one reason I get when I delve down to it about fasting before training is the fact, well, it'll increase the percentage of fat that I'm burning. Anyway, I can absolutely state without any problems that is not true. It depends on the intensity. So if you go
Yes.
to fasted and non-fasted, you will burn the same amount of.
That's, I guess, what I was trying to say. It was the same amount no matter what you do.
Yeah.
Yeah. But that is the whole thing. It comes down to I get up and work out in the morning and I'm not going to have a big meal, but I have my coffee and my water and, feel okay having something in my coffee. But that's been a big thing last few years with athletes, not eating anything. And I don't want to break my fast. So I'm not putting anything in my coffee and I have to just drink water and I don't know. Anyways, I don't want to take too much of
Life's
your
hard
day.
enough training for triathlons without having to do that, you know.
Yeah,
I
know.
working with Ironmanners was just like, I mean, I love them to death. But it was just, you would talk with them, you would test them, you would show them. They go downstairs, have a coffee with a couple of other triathletes and see their training program and just completely forget everything and do their training program because, oh man, they're getting an extra ride in. And you've really got to have the confidence in your team around you that for you to be able to stick with the program designed for you.
Yeah, so true. I know. That's why it's hard not to. It's easier to train on your own, but you want that, team to have people. But I think when you train with other people, you're not listening to what your training schedule is necessarily, what intensity and your heart rate you're supposed to
Yeah.
be in. So, all right, let's tell everyone where to find you in your new journey.
So I'll be moving to a little town called Gamblesby in Cumbria, so northern England, just outside of Penrith, in a week. So I'll be living in a nice old church that I bought from 1868.
Really? How fun.
Yeah, it's been renovated up there, and be working out of a clinic called Absolute Physiotherapy in Penrith, and so I'll be serving that area. But again, I'll be serving internationally anyway, as I work with a bunch of other companies and I consult. So for people that get tested, that if they want to know about their data more in depth, for coaches that want to know more about it, I set time aside to do international consulting as well. And you can find me at Strategic Health and Performance. And you can reach out to me there.
Super. Yeah, I know. I was telling you a lot of my clients live out that way. So we'll send them take a train ride out there and get a real test done and figure out where they are so we can not guess on a Zoom call.
Yeah, for people that are interested, I created an education program on metabolic analysis. It was 4 levels, recognized by ACSM, AFAA, and I'll be reopening that again in the near future for those people that want to learn more about how to do the testing and how to do the analysis, and then how to prescribe programming as well.
Good deal. Well, thank you so much for your information. I'm sure we'll have a lot more questions coming in. So we'll send everyone your way. And I think that sounds like a fun adventure. I was going to ask, are you a Canadian citizen? You live in all these different countries. Do you just get a global passport?
Yeah, I'm a proud Canadian. Yeah, but right now I'm a resident So you have to be in England for 5 years, then you can become a citizen. But I'm a resident of the UK, but I'm a Canadian. Yeah.
Yeah, me too. I'm still Canadian. Born in
Yeah.
Winnipeg, lived in Vancouver, but keeping that as a backup plan. Gotta have it.
We're very lucky, aren't we?
Yeah, so true. All right. Well, thank you. Enjoy your day. We'll put all the links in the show notes and we'll answer questions on the YouTube channel, Low Carb Coaching, and more. So thanks for your wise thoughts and all your multiple education sources, putting that all together to be the mentor and coach for us athletes trying to improve ourselves.
Absolutely my pleasure. It's an absolute joy.